Welcome to DICARE Medi Clinic, your trusted source for clear and simple explanations about human diseases. Today we're talking about a disease that still affects millions of people around the world, tuberculosis or TB. What causes it? How do you spot it early? What can you do in an emergency? Stay with us. This 5-minute video could save a life. Tuberculosis is a contagious bacterial infection caused by Mycobacterium tuberculosis. It mostly affects the lungs, but it can also impact the spine, brain, kidneys, and other organs. It spreads through the air when a person with active TB coughs, sneezes, or speaks, and someone nearby breathes in the bacteria. The main cause of TB is the bacteria Mycobacterium tuberculosis. But why do some people get sick while others don't? Key risk factors include 1. Weakened immune system, like HIV/AIDS. 2. Malnutrition. 3. Smoking or substance abuse. 4. Living in crowded or poorly ventilated spaces. 5. Close contact with someone who has active TB. How do you know if someone has TB? Here are the key symptoms to watch for. 1. Persistent cough, more than 3 weeks. 2. Coughing up blood or sputum. 3. Fever and chills. 4. Night sweats. 5. Unexplained weight loss. 6. Chest pain. 7. Fatigue or weakness. If left untreated, TB can lead to serious complications, including 1. Permanent lung damage. 2. TB meningitis, if it spreads to the brain. 3. Bone and joint damage. 4. Liver or kidney failure. 5. Death in severe untreated cases. This is why early diagnosis and proper treatment are so important. If you suspect someone has TB, especially if they are coughing persistently with blood or have major fatigue, here's what to do. First aid steps. 1. Isolate the person. Have them wear a mask and stay in a ventilated room. 2. Avoid close contact to protect yourself and others. 3. Encourage them to see a doctor immediately for testing and diagnosis. 4. Do not panic. TB is treatable, especially if caught early. Managing TB requires patience and commitment. Treatment usually includes a combination of antibiotics, like isoniazid, rifampin, ethambutol, and pyrazinamide. Regular follow-up with a doctor. Support for nutrition and rest. In some countries, the BCG vaccine is given at birth to help protect against severe TB in children. The key to successful treatment is completing the full course of antibiotics. Stopping early can lead to drug-resistant TB, which is much harder to treat. Tuberculosis is dangerous, but it can be cured. Early detection, proper care, and public awareness are our strongest weapons. If you learned something valuable today, give this video a thumbs up, share it, and subscribe to DICARE Medi Clinic for more health education videos. Together, let's spread knowledge, not infection. See you in the next video.